Hi. I'm here to ask about the nicotine patch. I want to quit smoking, and I'm wondering if this could help me.
Hi, I'm Luna, the pharmacist. That's a fantastic step you're taking. I'm here to help you through this. Please have a seat in our private counseling area. It'll be a comfortable space to chat.
Thank you, I really appreciate it.
Of course. Can I have your name and age, please?
Sure, I'm Michael Patel, and I'm 35 years old.
Great to meet you, Michael. I understand you're interested in quitting smoking and considering using nicotine patches. It's a big decision. Quitting smoking is challenging, but achievable with the right support and resources. And I'm glad you're reaching out for guidance. Before we dive deeper, I'd like to ask you a few questions about your smoking habits, medical history, and lifestyle, if that's okay.
Absolutely, go ahead.
What prompted you to come in for help with quitting smoking today?
Well, I work from home and I've been under a lot of work-related stress lately. Juggling deadlines makes me feel overwhelmed, and I often turn to smoking as a way to cope. Plus, I'm a father of two, and I really want to set a good example for them as they grow up.
That's really commendable, Michael. It's awesome that you want to be a positive role model for your kids. Have you tried to quit smoking before?
No, this is my first attempt.
Okay. And how long have you been smoking?
About 5 years.
All right, let's talk a bit about your smoking habits. How many cigarettes do you typically smoke in a day?
I usually smoke about 15 cigarettes a day.
Got it. And when do you typically have your first cigarette in the morning?
I usually light up about 30 minutes after I wake up.
I see. You mentioned that work stress triggers your smoking. Can you share more about how smoking helps you cope with that stress?
Smoking gives me a quick break when I'm feeling overwhelmed. It helps me feel calmer for a little while, almost like it clears my mind. I know it's not a healthy way to deal with stress, but in the moment, it feels like a relief.
I completely understand. It's a tough cycle to break. Do you have any medical conditions I should be aware of?
Yes, I've been diagnosed with psychosis for the past 2 years, and I'm taking clozapine, 300 milligrams.
Okay, and are you taking it regularly?
Yes, I take it every day without fail.
That's great to hear. Is your condition well managed?
Yes, I'm doing well.
That's good to hear. Have you experienced any side effects?
No, I am fine.
Perfect. Other than clozapine, are you on any other prescription medications?
No, just that.
How about non-prescription medications?
No, nothing like that.
Any herbal supplements or anything?
Nope, nothing at all.
Do you have any allergies?
No allergies.
Good to know. Do you drink alcohol at all?
No, I don't drink.
And what about caffeinated beverages like coffee or tea?
I'm definitely a coffee person.
How many cups do you typically have in a day?
I usually have 1 to 2 cups.
That's good to hear. Thanks for sharing all that information. Can you give me a couple of minutes to check my references? I'll be right back with some helpful information.
Sure, take your time.
Thank you for your patience. Based on what I found, nicotine patches can be a helpful tool for quitting smoking. They deliver a small, steady amount of nicotine throughout the day, which can help reduce cravings and withdrawal symptoms. While nicotine patches are generally safe, I strongly encourage you to consult your doctor before starting nicotine replacement therapy, especially since you're taking clozapine, to ensure it is safe for you to use the nicotine patch while on this medication.
That's really good information, thank you.
Of course, the doctor will be able to assess your situation and recommend the right approach for quitting. I want to mention that any change in smoking habits can have significant effects on patients taking clozapine. Smoking can actually make this medication less effective because it speeds up how your body processes the drug. When you stop smoking, the concentration of clozapine in your body might increase, which could lead to toxicity. So, your doctor may need to adjust your clozapine dose to ensure it continues to work effectively for you, and keeping an eye on your clozapine levels. When's your next appointment with them?
I can see them in 2 days.
Perfect. It's also a good idea to set a quit date, ideally within the next 1 to 2 weeks. Sharing this date with your family and friends can help them support you in your journey to quit and encourage them to avoid smoking around you.
I'll definitely do that.
Great! And here are some self-care tips. Try removing triggers like ashtrays from your car or bedroom. Clean areas to eliminate any lingering cigarette smell. and try to avoid being around people who smoke for the first few weeks. It's also helpful to develop new habits to distract you from cravings, like starting a fitness routine, picking up a new hobby, taking walks, or practicing breathing techniques to manage stress. Healthy snacks like carrots or celery can be good substitutes, and you might want to cut back on coffee a bit.
That sounds manageable.
And remember, there are many community resources available to help you, such as behavioral counseling or smoking cessation programs.
Thank you for all of this information.
Not at all. Can we follow up with you via phone to see how you're doing?
Yes, that would be great. Thank you, Luna.
You're welcome, Michael. I'm here to support you every step of the way.